What's up? It's your boy EJ, and I am here today at the Chiropractic and Wellness Center in Middlebury, Connecticut, getting ready to get a session with the infamous Dr. Rizza. He's going to help me fix my back problem. So today y'all going to find out what I've really been going through. He's going to talk to you and he's going to show you what he's going to do to me. So let's get ready to get this thing started. Mask up. All right, we're in the office right now with Dr. Rizza.
Correct.
He and his staff.
How we doing?
Come back to me, man. He and his staff are fully vaccinated, and I'm on the way to getting fully vaccinated.
Yes, sir.
They're safe. We're safe, and we're going to get ready to get to work. I'm going to give him authorization and permission to talk about my assessment and what he's going to do to help me. So, Dr. Rizza.
So how you doing? My name is Dr. Jason Rizza. We're here in Middlebury, Connecticut. Today we're going to be doing some myofascial cupping with my man over here. My original assessment of him, he trains very, very hard. And with that training does come injuries. So we're going to be using some cupping today. He has some lumbar facet syndrome, which is basically, it is inflammation and it is joint restriction to the lumbar facet joints, which are right through here. He also has some mild, what's called lumbar radiculopathy, which just means he has pain going down his legs caused from some disc issues in the lumbar spine. We have also, when we assess them, some myofascial pain syndrome, which sounds way worse than it really is. It means my man beats up his body training and he has pain.
You better know I do.
So what we're going to do is help to release some of those tight muscles, and we're going to work on the health and the function of his joints, because without a healthy joints, the muscles are not going to contract. So what I like to say is you could train the muscles all day long. You could rehab muscles all day long. If you don't work on the joints that correspond to those specific muscles, your training is not going to work as well for you. So we're all about optimizing that function for all patients, but especially my man right here. So we're going to get started. He's going to take his shirt off. Ladies, calm down. And we're going to start with some myofascial.
Ladies and Justin, that's the guy behind the camera.
All right.
Calm down, man.
It's important to note here, though, there are some individuals that should not have myofascial cupping done. There are some contraindications to cupping. He does not have any. So it's not that we want to just go on to, let me put the paper down for you. It's not that we just want to go on to Amazon, buy a cupping set, and just start cupping every area where we have pain. When you have acute injury, you would not want to cup those areas. That would make the injury worse. When you have chronic muscular tightness, myofascial cupping can be indicated as one treatment that can be successful. I found that in practice for males and females that train extremely hard, that myofascial cupping works extremely well. So the first thing we're going to do is we're going to address his leg length right down here. If you look right here, his right hip is dropped slightly. It's going to show me he has tightness in that right hip flexor. And if we're looking here, we have just a little pelvic obliquity, it's called. So his right side is a little bit higher. I believe he's also right side dominant. So what we're going to do is we're going to use these wedges to balance the pelvis. So here we go. There we go, relax right there. And right here. Then we reassess. Much more even. Because the foundation does start feet up. So now we're going to assess for tone, temperature, and the tone, temperature, and spasm looking, feeling in the musculature through here. So around the rector spinae, we have a lot of tightness through here. Working into the rotator cuff, we do have some tightness as well on the right, on the left as well. And then we're also going to come into that lumbar spine, which that's originally why he presented in the office a couple weeks ago. It was for low back pain with intermittent radicular symptoms. And if you saw his video on training legs, we'll definitely know why he has some low back pain and leg pain.
Don't skip leg day.
He does not skip leg day. Let's get a good picture of these legs. And he does the hip. Yeah. And he does do a lot of hip thrusts too, I noticed. So while I'm assessing the tone of the musculature, I'm also assessing the joint health. Every joint in the body should move like you're pressing into this table. See how there's a healthy bounce into the table? If we zoom over to the wall, and we press into the wall, these are what unhealthy joints would feel like. Really restricted, and that can happen for numerous reasons. It could happen for structural reasons, biochemical reasons, and then psychosomatic reasons. For him, our reason is completely structural. It's one of the side effects of training. We have many benefits to resistance training and cardiovascular training. However, there are some consequences that our bodies do pay when we train as hard. Now while the cups are on, we're going to focus our attention onto the right glute medius, piriformis. We're going to work through these musculature here, doing some pin and stretch. So we're going to lift up the leg. So these muscles traditionally function to externally rotate. What we're doing is we're stretching them into internal rotation. And as a chiropractor, I feel it's very important. A lot of chiropractors focus on, I don't want to say just the manipulation aspect of chiropractic care, but it's also very important to work not only the joints to help the muscles contract better, but to focus on the muscles as well. Because when you could retrain a muscle to contract more optimally, the patient's goals are going to be met much faster. And even when we look at the range of motion here, full healthy range of motion. The right side we are a little restricted. Alright, we're also going to use a hypervolt massage gun on the lower body, help increase circulation, decrease scar tissue. So we're going to work through again that piriformis, glute medius, glute max. What are we training today?
It is the upper body. So it's a combination of chest and back. 2 chest exercises, 2 back exercises, 1 exercise for the biceps, and 1 for the triceps.
Nice.
So 6 movements, and hopefully we're out of here.
Where are we training today?
Most likely at Still Beach.
We're gonna make them taller.
Stretch them out.
Yo, the funny thing, my sister asked me if I got taller. said, I think he stretched my spine.
Stretched him out.
So that inch I lost, I grew.
He grew now.
Make sure you record that, Justin. I think I'm taller than you now.
Yeah. Make sure the important thing here to note today, if it would take away anything at all from our session here, is that he's now taller.
Oh, he let me down hard.
That's called flexion distraction.
Okay, gotcha.
We like to use that with people who have some lumbar facet syndrome. Also when there's pain into the legs, because it helps to create more space into the intervertebral foramen, which basically just holds that line of the spine where nerves can get entrapped or some nerve impingement can occur.
Gotcha.
So now we're going to take off the cups. Usually like to do between 5 and 15 minutes with cupping, dependent upon how often you're using the treatment. Again, because it's only our second session using the cups, we don't leave them on as long. Because there's always too much of a good thing. Because the cups will recreate injury, which means that it will increase circulation, increase healing factors, go into the localized areas. However, if you leave the cups on too long, sometimes you set someone back a little too far because the body then needs to go heal that injury again. Now we're just going to work on some of the muscles that help to rotate the scapula. So we're going to do some pinning and stretching here. And I know he is working on some of that scapular rotation, so we're just kind of aiding him in doing that. So now we're going to assess the thoracic spine leading into the cervical thoracic junction for what we will call restrictions. And that's kind of what we went through before, talking about how the joints move. So on the lower thoracic spine, we definitely have some restrictions through here. There's different ways to adjust those areas. Let's start just superior to the scapula at the cervical thoracic junction. And we're going to drop our arm right here. So, from a chiropractic standpoint, it's not about how hard you can adjust someone. It's all about the technique and helping that person to attain relief of their symptoms. There we go. And also the funny part too is...
Did you capture it? Just joking, just joking.
Yeah, actually, it's funny that you say that, because what I was just going to say is, sometimes you could hear an audible, what's called a cavitation or cracking, right? Sometimes only the patient could hear it. In school, they teach you don't get paid by the decibel. So as long as you put an input into the joint from a neurological system, from a neurological standpoint, the patient should feel better if you're assessing and correcting the right joint. There we go. Other side.
It's cracking my whole body up now.
Sounds like you're snoozing.
I felt good. I did snooze for a little bit.
There we go.
You gotta get it in when you can, right?
All right, so now we're going to work through the pecs. There we go. And then some more pinning and stretching. So we're coming into the pec, and we're coming into external rotation. People in general, not even just resistance training athletes, tend to have what's called a forward head carriage and rolled shoulders. There he is.
All them years of desk work.
Yes. Yes. It's funny. You would think it's primarily people lifting. No. Secretaries come in here. Really, anyone that's sitting in front of a computer all day. And not to give the the typical chiropractic answer, but posture is very important. Cross his arms. just like I mentioned before, just in the middle of his thoracic spine, right about T5, T6. We're gonna come in and we're gonna manipulate this area. This is an A to P manipulation. So you can see I'm making a fist. We're coming on over, and we're coming on down. Same thing here. We're gonna scooch down a little bit more. Now we're going to address the joint dysfunction around the scapula. So we're going to have him bend his arm and scooch down one more time. Moving. Good. Coming right here. So this hand is going to come back here. I'm not sure if you want to catch this on this side. Right medial to the scapula, and we're going to adjust what's called the scapular thoracic joint. There we go. One more. Relax that shoulder. There we go. Come. Alright, so we can definitely feel some restriction at the top of the cervical spine. So that's the cervical cervical occipital joints. Right here. That $1 million smile. This is the pretzel position. You gotta hug yourself, love yourself. Then the top one. Okay. Straight up the bottom leg. Right here. Good. Okay. Bring the head back right into the cradle. There we go. Okay, we're gonna take a big breath in. And right here, we're gonna be adjusting those lumbar facet joints. There we go. Other side.
I get those ones done too.
I heard it. You felt it.
I got myself the wrong way.
Listen, I tell people you gotta leave me with something. Scooch on over. I haven't dropped anybody yet. We're not gonna start with you. There we go. Come on up. Now, we're going to work on the forearms. So some little pin and stretch in the forearm.
I think I'm going to have a good workout today.
I think you have a great one. I think I'm getting my workout in right now. Right, relax it.
Even the thumb pops, man. Yeah. Even the thumb stiff, man.
Come right through here. Relax your arm. There we go. It looks like an MMA move, but it's not.
Dr. J is wiping me off. I think I put a little bit too much cocoa butter on today. My bad.
Yes, but at least your skin's moisturized.
That it is.
And so is the table now.
100%, man.
But we will clean it. Zoom on over. You'll see the cleaning supplies.
You should see the workout benches after.
When I get done sweating, right? You don't know nothing about that, man.
You gotta carry around a napkin.
Just a napkin?
I be having a towel in my bag. He don't want to use my towel.
You're all set, brother.
Thank you, sir. I appreciate it.
Hey, my man.
Y'all ever need some work done? Just to make sure we capture just this last part. Y'all ever need some work done? Y'all make sure y'all come and check out Dr. J. Rizza in Middlebury, Connecticut. It's the best.
Thank you very much. It's been a pleasure.